everyone, I am Jamar Bilano and we are the Group 7. We are delighted to be presenting with you today about prenatal development. We will tackle about prenatal developmental processes or stages, common hazards, and about the gift of life manifested in an anti-abortion stand. All of the developmental theories we discussed in depth focused on the process of growth after birth. They were unconcerned about what happened before they were born. It may be useful to comprehend the beginnings of the child and teenager, the learners, in order to complete the description of human development. The prenatal development is divided into 3 periods: the germinal, embryonic, and fetal period. The first period of prenatal development is the germinal period. Germinal period is the first 2 weeks after conception. So this includes the creation of zygote, continued cell division, and the attachment of zygote to the uterine wall. To further understand this period, let me give you details of development during this period. We will start with 24 to 30 hours after fertilization. The male or sperm and female or egg chromosome unite. In 36 hours, the fertilized ovum, zygote, divides into 2 cells. In 48 hours or 2 days, 2 cells becomes 4 cells. In 72 hours or 3 days, 4 cells becomes a small compact ball of 16 to 32 cells. In 96 hours or 4 days, hollow ball of 64 to 128 cells. In 4 to 5 days, inner cell mass or the blastocyst still free in the uterus. In 6 to 7 days, blastocyst attaches to the wall of uterus. Lastly, in 11 to 15 days, implantation happens. This is when the blastocyst invades into uterine wall and becomes implanted in it. As the inner and exterior layers of the organism form during the germinal phase, cell differentiation occurs. The blastocyst, the inner layer of cells that forms during the germinal stage, matures into the embryo later. The trophoblast, a layer of cells that forms throughout the germinal stage and later gives nutrition and support to the embryo.
The second period of the prenatal development is the embryonic period or 2 to 8 weeks after conception. In this stage, the name of the mast cell zygote become embryo. These are the following developments take place. Cell differentiation intensifies, life support system for the embryo develop, and lastly, organs appear. As the zygote gets attached to the wall of the uterus, 2 layers of cells are formed. The embryo's endoderm is the inner layer of cells, which develop into digestive and respiratory systems. And the outer layer of cells is divided into 2 parts, the ectoderm and the mesoderm. The ectoderm is the outermost layer, which become the nervous system, sensory receptors like eyes, ears, and nose, and skin parts like nails and hair. The mesoderm is the middle layer, which become the circulatory, skeletal, muscular, excretory, and the reproductive systems. This process of organs formation during the first 2 months of prenatal development is called organogenesis. As the 3 layers of the embryo form, the support system for the embryo develop rapidly. These life support systems are the placenta, the umbilical cord, and the amnion. The placenta is a life support system that consists of a disc-shaped group of tissues in which small blood vessels from the mother and the offspring intertwine but do not join. The umbilical cord contains 2 arteries and 1 vein that connects the baby to the placenta. And the amnion is a bag or an envelope that contains a clear fluid in which the developing embryo floats. All these embryo life support systems develop from the fertilized egg and not from the mother's body. Fetal period are 2 months to 7 months after conception. During this period, growth and development continue dramatically. Let me give you the details of the development process by Soundtrack 2012. 3 months after conception, the fetus is about 3 inches long and weigh about 1 ounce. Fetus has become active, moves its arm and legs, opens and closes its mouth, and move its head. The face, forehead, eyelids, nose, chin can now be distinguished, and also upper arms, lower arms, hands, and lower limbs. The genitals can now be identified as male or female. 4 months after conception, fetus is about 6 inches long and weighs 4 to 7 ounces. The growth spurt occurs in the body's lower parts. Prenatal reflexes are stronger. Mother feels arm and legs movement for the first time. 5 months after conception, fetus is about 12 inches long and weighs close to a pound. Structures of skin like fingernails and toenails are formed, and fetus is more active. 6 months after conception, the fetus is about 14 inches long and weighs 1.5 pounds. Eyes and eyelids are completely formed. Fine layer of head covers the head grasping reflex is present and irregular movement occur. 7 months after conception, the fetus is about 16 inches long and weighs 3 pounds. And lastly, 8 to 9 months after conception, the fetus grows longer and gains substantial weight, about 4 pounds.
Teratology is a branch of the biological sciences dealing with the causes, development, description, and classification of congenital malformations in humans, plants, and animals, and with the experimental production. From the keyword teratogenicity, teratogens are substances that may produce physical or functional defects in the human embryo or fetus after the pregnant woman is exposed to the substance. Examples of these substances are cocaine and alcohol. What are those prescription drugs? Prescription drugs are often strong medications, which is why they require a prescription from a doctor or dentist. Prescription drug misuse has become a large public health problem because misuse can lead to addiction and even overdose deaths. Non-prescription drugs are defined as drugs that are safe and effective for use by the general public without advice from a health professional. Examples are aspirin or cough medicine. Non-prescribed medicines are sometimes called homely remedies. Psychoactive drugs, substances that affects how the brain works and causes changes in mood, awareness, thoughts, feelings, or behavior. A woman who uses cocaine during pregnancy may give birth prematurely or have a baby shorter in length than normal and with a low birth weight. Examples of psychoactive substances include alcohol, caffeine, nicotine, marijuana, and certain pain medicines.
Hazards. This include radiation in job sites and X-rays, environmental pollutants, toxic wastes, and prolonged exposure to heat in saunas and bathtubs. Research found that chromosomal abnormalities are higher among the offspring of fathers exposed to high levels of radiation in their occupations. This is according to Scragg and Dixon, 1985, cited by Soundtrack 2002. Radiation from X-rays also can affect the developing embryo and fetus, with the most dangerous time being the first several weeks after, when women do not yet know that they are pregnant. Researchers found that toxic wastes such as carbon monoxide, mercury, and lead cause defects in animals exposed to high doses. For instance, early exposure to lead affects children's mental development. This is according to Markowitz 2000 cited by Sandtrack 2002. Remember the action of the USA for the children's toys with high lead content manufactured in China? Exposure of pregnant mothers to sauna or hot tubs raises the mother's body temperature, creating fever that endangers the fetus. The high temperature due to fever may interfere with cell division and may cause birth defects or even fetal death of the fever occurs repeatedly for prolonged periods of time. Now let's go on to other maternal factors such as rubella, German measles, syphilis, genital herpes, AIDS, nutrition, high anxiety and stress, age, too early or too late beyond 30. So what is rubella? A rubella in 1964 to 65 resulted in 30,000 prenatal and neonatal newborn deaths and more than 20,000 affected infants who were born with malformations including mental retardation, blindness, deafness, and heart problems. So what is syphilis? Syphilis damages organs after they have formed. These damages include eye lesions, which can cause blindness, and skin lesions. When syphilis is present at birth, other problems involving the central nervous system and gastrointestinal tract can develop. About 1/3 of babies delivered through a herpes-infected birth canal die. Another 1/4 become brain damage. A mother can infect her child in 3 ways. Number 1, during gestation across the placenta. Number 2, during delivery through contact with maternal blood or fluids. And number 3, postpartum after birth through breastfeeding. Studies show that increased stress during pregnancy leads to premature birth and reduced birth weight. Other studies have shown that increased stress during pregnancy is related to ADHD, even schizophrenia later in life. Admittedly, more research into the effects of emotional states and stress needs to be conducted for more conclusive findings. It is recognized that maternal malnutrition during pregnancy may result to inadequate growth in the fetus. If a fetus does not receive enough nourishment, the rate of the cell division is seriously hampered. Folic acid is necessary for pregnant mothers. Folic acid can reduce the risk of having a baby with a serious birth defect of the brain and spinal cord, called the neural baby tube. A baby with spina bifida, the most common neural tube defect, is born with a spine that is not closed. The exposed nerves are damaged, leaving the child with varying degrees of paralysis and sometimes mental retardation. The mortality rate of infants born to adolescent mothers is double that of infants born to mothers in their 20s. A baby with Down syndrome rarely is born to mother under age 30, but the risk increases after the mother reaches 30. By age 40, the probability is slightly over 1 in 100, and by age 50, it is almost 1 in 10. The risk is also higher before age 18. Now let's go on to paternal factors. Fathers exposed to lead radiation, certain pesticides, and petrochemicals may cause abnormalities in sperm that lead to miscarriage or diseases such as childhood cancer. As in the case of older mothers, older fathers also may place offspring at risk for certain defects.
Human life begins at conception. That which is in the mother's womb is indeed in a developing human being. An unborn baby of 8 weeks is not essentially different from one of 18 weeks or 28 weeks. From conception to zygote, the embryo and the fetus are undeniably human life. Human life begins from the moment of conception. all that we have and all that we are have been there at the moment of conception. The fact that you have brown eyes and black, straight or curly hair, and the fact that you will turn bald at age 50 have been there already at the moment of conception. That were added in the process of development is nutrition.
I remember about The Silent Scream, a film about abortion. In the 3rd month of her pregnancy, the mother went to a doctor for an abortion. When the abortionist inserted his scalpel into the woman's womb to crush the fetus head, the fetus' lips was open like he was crying for aid as he escaped the abortionist's lethal scalpel. That is why the film is titled The Silent Scream, which simply signifies that the developing creature in the womb is a human being rather than a collection of cells or tissues. Abortion is unethical in light of these facts. The womb is thought to be the safest environment for human development. Unfortunately, the evil of abortion has turned it into a mausoleum. The 3 stages of development proves that the developing embryo in the mother's womb is a true human being. I believe that life is valuable, even when it is unwanted, even when it is physically imperfect. This is why I am against abortion. Abortion does not make you unpregnant. It makes you the mother of a dead baby. As for those who are victims of rape promoting abortion, it's not that I am invalidating your feelings. It's just that abortion clearly doesn't save you from the pain of rape. It just leaves you with a gaping hole and a dead body.
Thank you for watching, everyone. I hope you learned something from our presentation. We appreciate you taking the time to listen to our discussion on prenatal development. We are the Group 7 once again. Thank you very much. Stay safe and God bless.